Welcome to the Inflammation and Immune Dysfunction module preview. This is a module preview, a mini masterclass where we're talking about why your immune system feels the way it does and why it shapes how you age. Before we begin, a little bit about myself. My name is Dr. Sajad Zalzala. People call me Dr. Z. I'm a board-certified physician focused on longevity, brain health, prevention, immune health, and general longevity. Over the past 2 decades, I focused my work on translating complex aging science into practical, measurable clinical systems. I'm the co-founder and former chief medical officer of AgeLessRx, one of the first nationwide telemedicine platforms dedicated for longevity. And I've worked with many other telehealth companies. I've authored or co-authored peer-reviewed research in aging, including topics on metabolism, rapamycin, low-dose naltrexone, and health span optimization. And I've been advisor to multiple digital health companies and diagnostic companies. The framework that you're about to preview today is 2 decades in the making. It reflects my years of clinical pattern recognition and not just based on theory alone. So it's not just another popular health book based on theory, and I'll go more into it. So let me first start by talking about what most people miss about immune health. Immune and inflammation cover a wide topic, but in general, most people notice immune declines in subtle ways. They get more sick. They get sick more often than they used to. It takes longer for them to recover, or they have unexplained inflammation that lingers longer around. They have maybe some autoimmune issues where the immune system's out of balance. And then the popular common assumption is that you're missing something. You might be low on vitamin D, which could be true, but it's an incomplete answer at best. There are a lot of people out there in the popular health field that say, hey, use my protocol, use this protocol, and a lot of the times, sometimes those protocols work, but a lot of times they turn out to be incomplete. So what I've come up with is a different way of understanding of how the immune function works and changes over time, and then what you can do about it. So what we're going to cover on this module preview. We're going to talk about the immune system patterns, how things like fatigue, infection, pain emerge along a predictable spectrum. We're talking about immune and inflammation drift, what happens over time or after an event, let's say a viral event, for example. And then we're going to talk about how we assess the immune function, the assessment framework. And then just like a lot of our modules, we talk about the archetypes and the importance of the archetypes to try to understand the underlying problems and help guide the intervention recommendations. And then we'll go through some patient cases, what can be expected, based on the archetypes. So let's get started here. So why does your inflammation or your immune system feel the way it does? Most people don't think about their immune system until something goes wrong, because your immune system is under constant surveillance. It was, designed over, it was designed to help protect us against foreign invaders of all sorts, known and unknown. But sometimes that system can go wrong and cause, just not work properly and, allow too many invaders in, or a lot of times you get runaway inflammation or an imbalanced immune system. So the immune system is supposed to accurately detect and identify potential threats, and then mount a proportional and appropriate response. Again, sometimes the immune system gets out of hand when it gets imbalanced, and then it's supposed to efficiently resolve that inflammation and then kind of go back to surveillance mode. So that's kind of how it's supposed to operate. We can talk, in the full module, we'll talk more about what goes wrong and what to do about it, how to identify what went wrong and what to do about it. So the reframe here is that immune systems are not isolated problems. You shouldn't just take prednisone if you have an autoimmune condition, for example, because that suppresses the symptoms. It doesn't really treat the underlying cause. I mean, I'm not against taking prednisone, for example, as a short-term rescue medication, but it shouldn't be it shouldn't be the end-all be-all. So we're going to be talking about immune load, immune balance, understand the changes. And going from eliminating the symptoms, which prednisone eliminate a lot of these symptoms, for example, to help restoring balance and regulation. Why does this matter? I mean, immune function cuts across a lot of different things, cardiovascular, neurodegeneration, frailty. In fact, it's so key to aging and premature aging. There's a term that was coined called inflammaging. And a lot of it, and so there's a very, the reason why I combined the, inflammation and immune function into a single module is because they're almost indistinguishable. They're two sides of the same coin. And so, it runs, like I said, cardiovascular disease, degeneration, muscle loss, infection or inappropriate responses to infection. And then these risks can rise, years before like an official diagnosis can be made. And just like with any dysfunction or disease, the earlier you catch it, the more likely you are to be able to do something about it. There are potentially, some points of no return, with some of these diseases, like we talked about in dementia, for example. If you lose a certain amount of brain cells, just right now we don't have any way to come back from that. Likewise, if you lose a certain amount of your immune function, it might be hard to come back from that. So the sooner somebody starts, the better. And that's why it's key to assess these things early rather than wait to problems. So be proactive about it rather than kind of the conventional medicine reactive model. This doesn't replace conventional medicine. This education module does not replace it, but it helps provide a guide to help restore balance. So what are some of the bottlenecks? Immune health is not just about strength. Said, I want to, really fight this virus. Well, I mean, you don't want to be too aggressive. You don't want your immune system to be too aggressive fighting a virus, because that's what happens in things like, SIRS, systemic inflammatory response syndrome. That's why, infections like COVID and other viral infections or bacterial infections can be very dangerous. It's because sometimes the immune system mounts too strong of a reaction. So you want an appropriate activation, appropriate targeting, and then you want it once the threat's gone, you want your troops to stand down, and that doesn't always happen. And then when the resolution falters, if you don't go back to normal, inflammation can persist, and then this can lead to a whole inflammatory cascade, which can lead to a whole series of dysfunction. This regulation bottleneck partially explains why immune aging manifests differently in different individuals. It's very individualized. And that's why you can have a whole host of symptoms that come out of this. Again, these are topics we'll talk more about in the complete module. So like I mentioned in previous modules, the key is to assess. So I've come up with a 10-question immune assessment. This is the subjective, the self-reported, where we'll capture information about burden recovery, inflammatory load, reactivity, and tolerance, and then kind of resilience. For the objective measurement, we'll walk you through capturing data on baseline inflammatory tone, immune balance and stress, and help identify early signs of immune aging and falter of the immune system using the various different biomarkers. We'll go into detail during the actual module. These markers shift along, they tend to shift, and you can pick up patterns long before you get a disease, and sometimes before symptoms occur, or early on in the symptomology anyway. And it offers kind of a window of opportunity to figure out what's going wrong and how to intervene. Why these markers matter? They're not. These assessments are not meant to give you a diagnosis. We're not going to be diagnosing anything during the course. What we are going to do, we're going to be looking for things like, the workload of your immune system, whether or not you have sufficient reserves, or immune burdens, for example. And then assessing allows us to trend these things over time, and with the idea of the interventions will allow us to improve the assessment over time, so you get a better and better score over time. Why do we do both markers? Again, the objective kind of looks at various different biomarkers, and the subjective is more like how you feel and what your symptoms are, and they're both very important. Some people may not have access to the objective markers, but everybody has access to subjective. I mean, everybody can tell me what, can take the self-assessment and tell me what they feel. And so that makes it much more accessible, but also provides meaningful information. And this is why it's very important to combine the two. Not every module will have both. Some modules may only have one or the other. But my goal was to try to introduce both a subjective and objective with all the modules. And it allows us to kind of integrate the perspective and get a more fine-tuned look at what might be going on. Now, just a quick note, I mean, these assessments are purposely general, meaning that it helps kind of guide in the right direction. But if they uncover a disease process, or if you suspect they have a disease process, you may need to dig deeper. And that's usually where, during the module, we'll talk about when to dig deeper, how to dig, where to go to dig deeper, things like that. So again, these assessments help us find patterns, and through pattern detection, we can then, provide guidance on what's been known to work for these types of patterns. So you have your individual markers, and then you get an integrated signal, and then the module is designed to provide explanation as to what these signals mean. And again, what to do about it. And we provide the resources during the module. So the goal of the assessment is to try to help identify what's called the immune archetypes. So these are patterns that I've come to recognize over my years of clinical practice. You can call them traffic patterns. They tend to be predictable, interpretable, and modifiable. And that's why I've kind of focused on these patterns, because, biology, biochemistry, it's all about pattern finding, and a lot of things in life. It's a science, it's not a magic, it's not voodoo, it's not, it's a science, and science runs on patterns. So it's about identifying those patterns and then help guide people into resources that can help them intervene and improve those patterns. You can have more than one archetype, but typically in my experience, people have one primary archetype, and then they might have secondaries. So wherever during the course, I'll teach how to identify the primary one and then what to do about it. And then, a lot of times that'll resolve the secondary ones, but not always, in which case then the next, once the primary one's resolved, the next secondary one can then become the new primary. And then you kind of keep going until you get as good as you can. Again, the goal is not always perfection. We'd love to see everybody in optimal, but that may not always be possible with every case, with every person. So we try to set realistic goals. Typically in clinical practice, 20% improvement is usually a winner, so to speak. But of course, we can get more than 20%. That would be amazing, I think. But 20% can go a long way. If you continue, it changes trajectory markedly over time. Let's talk about the pathophysiology of immune dysfunction. What goes wrong. We talked a little bit about this, but I'm going to go over a little bit more detail here. So you can end up with chronic low-grade inflammation. Again, that term inflammaging is here again. This is persistent cytokine and other signals that elevate the baseline of inflammation, accelerate tissue damage, and can lead to a lot of aspects of premature aging. Loss of immune tolerance. So when you're an infant or fetus, your immune system goes through this training, self versus not self, over time, or with some shifts in the immune system. Sometimes that starts to break down, and you start to lose immune tolerance, where self becomes the enemy for a variety of different things. And then impaired immune resolution. We talked about how people can get some kind of infection, and then they just their troops never stand down. And then as a person ages, or there could be things that prematurely age the immune system, you end up with what's called immunosenescence, where senescence means becoming kind of obsolete or ineffective. So immunosenescence basically means where immune system starts becoming ineffective over time. and just not able to keep up. And that's why, infections is one of the leading causes of death in the United States, especially for older people. And the risk of, you look at the pandemic we had a few years ago, the number one risk factor for not doing well with the coronavirus was age. It's not diabetes status, not any of those statuses, it was age. And because of this issue with immunosenescence. So there are some things that can be that we can do about it. Again, we don't have the technology to turn your immune system all the way back, although I think in the future we will be able to. But there's a lot that can be done today to improve the immunosenescence and slow that down, maybe even reverse some aspects of it. All right, so let's go to the archetypes. Oh, looks like my slides got mixed up here. So archetype 1 is the inflammaging pattern. This is chronic low-grade inflammation. The strength of the immune system is largely intact, but there's just so much underlying noise that the immune system has a hard time differentiating between signal and noise, and starts it starts going after parts of the body that it shouldn't. Archetype number 2 is the autoimmune tilt. Again, losing tolerance, and you start attacking tissues like the thyroid, like the joints, the lining of the arteries, for example. The immune system just doesn't know when to shut off, and just and you suffer from a lot of friendly fire. Archetype 3 is the immunosenescence pattern that we talked about. This is usually signs of this is you get sick frequently, hard to recover. You get knocked on your butt for a simple cold. Low stamina, and then any little stressors, you get sick. We've all been sick after, let's say, trying to cram for an exam, for example, if you're in the medical profession or other professions. You can tell how an acute stressor can really weaken the immune system. For some people, the threshold becomes a lot lower, and you get people get infections from just even simple stressors. And then type 4 is the mixed immune. It's kind of a mix of those three that we talked about. This can be a little bit more challenging because you need to be a little bit more aggressive with trying to treat it, or persistent with trying to treat it. Now the good news is that identifying this pattern or any pattern kind of provides the earliest you identify it, the more likely you are to be able to do something about it. People say, your immune system generating all inflammation, just take an anti-inflammatory. The word inflammation, admittedly is used a lot, improperly or incorrectly. You can't just, throw on a generic anti-inflammatory and expect it to work. It has to be targeted. Again, going from the archetypes, from the assessment to the archetype allows us to go into a strategy, figure out what the underlying problems are, explain the responses, figure out where the stress points are, what goes wrong, identifying the patterns, and then following a structured intervention, targeted interventions for what is most likely gonna cause the best resolution or the best improvement. How we track immune improvement is the same way we track in all modules. Again, reassessment. So assess, intervene, reassess, and then just continue that as many times as it takes to get the right outcomes. We'll cover all that in details in the module. But what we hope to accomplish is fewer infection, faster recovery, lower overall inflammatory load, improves immune stability, and better resilience. So you don't get knocked on your butt for a whole week from a cold every time a cold comes by, for example. So here's a case case that I like to highlight. The person reports persistent fatigue, low energy, frequent minor infections. They tend to get every cold that runs around the neighborhood, and then they can have some symptoms of joint stiffness. Lab findings will usually find high CRP, maybe an elevated ferritin. If you look at their lymphocyte counts, for example, you'll see some subtle variations there, which indicates like an immune shift. What we do about this sort of thing is we would try to stabilize the energy to improve stamina. and target the inflammation with various different interventions. We'll talk more about during the module. And what we hope to see is a reduction in the inflammatory markers and a balancing, restored balance in the immune markers. Here's another case of a person who would report joint pain, stiffness, sometimes migratory from one joint to the other. They might have recurrent rashes or other kind of skin flares, sensitivity to certain foods. I mean, humans shouldn't really be sensitive to any foods. I mean, we're designed to eat pretty much everything. Well, within reason, obviously, but we shouldn't be responding to to regular proteins, to fruit proteins or to grain proteins, for example. And then this person also had fluctuating energy levels. Sometimes they have really bad fatigue, and sometimes they have normal energy. If you look at different markers, a lot of them may be within normal limits. When they get a cold or a sinus infection or something, it'll get treated and then they recover, but then it just seems like they're back in the doctor's office again. The pattern we would identify here would be the autoimmune tilt. Their immune system is kind of like waxing and waning, and sometimes is doing well, but then other times starts becoming too aggressive. They're very reactive to triggers. They get frequent or semi-frequent flare-ups. And then we'll see some of these, during a flare-up, we'll see some of the activation of the immune system. And the goal here would be to reduce or improve or balance the immune tolerance to keep it from overreacting. After the targeted intervention, we would expect to see the flares become less frequent. Symptoms would stabilize. They're not going to have as much stiffness and whatnot. And then they're more resilient. They don't catch every cold that goes around. Again, the goal is not suppressing. We're not suppressing the immune system. We're not. I don't recommend putting people on prednisone as part of this program, because prednisone is a bandage. If you need prednisone, you need to go to a doctor's office to get it. And be assessed properly. The goal of this module or this education program is to help identify therapies that will help balance the immune system. All right, here's another case. Again, frequent respiratory infections, slow to recover, and then just general decline in stamina. When you look, they'll report what's called a high immune cost, poor recovery, and the objective signals will show decline immune resilience. This is the archetype number 3, the immunosenescent pattern. Typically, this will be an older person. It's just the immune system is just not as robust as it used to be. So after some recommended interventions, we expect to see not as shut down or not as prone to getting infection. Improved recovery, improved energy, because you're reducing the inflammatory load, and then we tend to put somebody on a shift from decline to stability, and maybe even improvement over time. So what actually changes, when we get it right and we do the targeted interventions properly, we expect to see lower baseline immune stress, faster recovery, greater resilience. When the idea is to keep the immune system as youthful as possible for as long as possible, and if we do that, then that'll stave off the other aspects of aging we talked about earlier on this module preview. Why assessment matters, because if you don't measure again, you don't know if you're on the right track or not. And the immune system can be dynamic. You can again fix one aspect of it, and maybe another aspect that was kind of hiding in the background comes up again. So it's always important, and it also keeps my students motivated. They see that the improvement, and they're like, this is actually working, and so they keep going. So again, like we talked about in the cases, we'll see all sorts of, expect to see all sorts of improvement in symptoms. Again, it may not be realistic to hit 0 symptoms. That's just not the way life works. But again, even just a small improvement can make big changes over time. How we track it, again, we talked about this. We kind of do the reassessment over time. And then, the theory of inflammation is that if you get that under control, then it can help with all the other diseases of aging as well. What we'll cover in the full module, we'll go over the immune assessment. We'll go over the biomarkers that we measure and what they mean. We'll go into more details, the archetypes. We'll talk a lot about the assessments and the targeted interventions that are discussed in the module, in this particular module, and then how to reassess. Also, how the immune system and immune function fits across the other domains. For example, you may not get anywhere with your immune function if you don't fix your sleep. Or immune system can be tied to mitochondria, for example. So during the full module, we'll talk more about how these modules interact, the different drivers of aging interact, and help provide some guidance on where to go next. Who this module is for and who it's not. So it's, first of all, it's not for people who are looking for like a quick fix, a quick hack. I mean, there's, in my opinion, I mean, sometimes people get lucky and a hack, does a trick for some people, but that's rare. And I don't necessarily recommend hacks. You'll never really hear me the word hack unless I'm being very specific about it. This is not a medical treatment plan. This is an education. I'll help provide resources, that might guide you to therapies, but this course is not for somebody looking for therapies. I will provide the resources though. If you're looking for general health advice, I mean, there's a lot of other courses out there that talk about general health advice. This is not one of them. Again, the reason I couple the assessment with the education is to help provide actionable items. So this is for people who prefer data and patterns over guessing, and for people who want to think long term, not how do I get rid of my my swollen ankle or something today. It's it's about, okay, how do I shift my immune system for a longer, healthier life. And then how this fits in, we talked about this a little bit. Cognition, mitochondrial function, gut. It's all one big connected web. What module you start with really kind of depends on where you think your biggest challenge is, and where you'll get the biggest bang for your buck. In my experience, most people know where their biggest challenge is and how to get started. If not, then we have tools to help people as well. So where does it go next? Again, the full module will talk about deeper immune pattern analysis. We'll talk more about the assessments, the interventions, and then the logic behind the science behind the intervention, and then how it integrates. So if you found this module preview helpful, this is a 20 to 30-minute video. Each module, the module itself is several times longer, and there'll be resources provided as well. So I hope you found this useful. You can also sign up for the webinar that goes over the entire framework. Gives an overview of the entire framework, or you can jump right into the module and see your assessment and see what's recommended. This is Dr. Z. Thank you very much for listening.